Dr. Chris Curran from East Carolina University will be presenting some of his work on the relationships between range of motion deficits and the material stiffness of critical soft tissue structures in the throwing arm of baseball pitchers. Chris?
Thank you very much, Bryson. So as most of us know, pitchers often undergo bilateral differences in range of motion and demonstrate altered shoulder range of motion in the throwing arm compared to the non-throwing arm. This is something that, if you're looking for a little more information, ASMI actually just put out a great master class on shoulder injuries recently. But pitchers that have glenohumeral internal rotation deficit greater than 20 degrees have been reported to be at increased risk of injury, and then recent more finite classifications of a total range of motion deficit in the shoulder of simply 5 degrees or shoulder flexion deficit of 5 degrees have been reported to place pitchers at more than 2.5 times greater risk to undergo injury. This work that I'm going to present here builds on some of the work presented by Dr. Dumeier on Wednesday, where we are also using shear wave ultrasound elastography to measure the material stiffness of soft tissues. And as he mentioned, we measure material stiffness as a proxy for tissue health. And we have reported bilateral differences in the past between the throwing and non-throwing arm in baseball pitchers, but those differences have not been related to these range of motion injury risk factors. So as a part of my research, we used 26 currently competitive adult baseball pitchers. They came in for 2 different research settings. In the first one, we performed bilateral shear wave ultrasound elastography of the UCL, the supraspinatus and infraspinatus muscle and tendon, and the biceps brachii long head muscle and tendon. We also tested their bilateral passive shoulder range of motion. During the research setting, the range of motion was taken in. That was the first thing performed when they came into the lab. So they hadn't warmed up or undergone any stretching yet. And then to examine bilateral differences, we performed t-tests, and then we also performed a 2x2 ANOVA to analyze relationships between material stiffnesses and the range of motion in individuals with clinical classifications of injury risk. As is typically seen, our pitchers, when we looked at our entire sample of asymptomatic pitchers, they presented with a decreased internal rotation in the throwing arm compared to the non-throwing arm, and an increase in external rotation in the throwing arm compared to the non-throwing arm. However, when you add those together, their total rotational motion was actually maintained bilaterally. I want to focus here in the last couple minutes of the presentation on just a sample of the results. There were a number more, but 2 main results I want to talk about looking at the clinical classifications for range of motion. So if you can see my mouse here, focusing on pitchers that either had GERD or did not, we saw a significant interaction between the supraspinatus tendon stiffness and in the throwing and non-throwing arm across that clinical classification. But perhaps the surprising finding is actually that the bilateral difference was seen, or the difference between groups was seen in the non-throwing arm. And so if you look at the interaction graph here, the non-throwing arm is on the right, the throwing arm is on the left. There's a large difference between pitchers with and without GERD in the non-throwing arm. The throwing arms were almost identical. And to us, this suggests that perhaps pitchers that naturally, if we use the non-throwing arm as their native state, which does have some assumptions with it, but is perhaps the best we have when doing cross-sectional research, if we use the non-throwing arm as a native state, perhaps pitchers that just naturally have decreased material stiffness in the supraspinatus tendon are at a greater risk for developing GERD as adult pitchers, and maybe we need to do some interventions in advance to try to prevent that. We also looked at the UCL, and we saw some interesting results here. So moving on to the second significant interaction that I'm focusing on today, pitchers that had total rotational motion deficits greater than 5 degrees versus those that didn't. Again, we see a larger difference across groups in the non-throwing arm than in the throwing arm. And it doesn't necessarily make sense that the stiffness of the UCL would influence the range of motion of the shoulder. And so perhaps we need to do some more research here to understand this, but our initial hypothesis would be that pitchers that present, again, with a naturally decreased material stiffness in the UCL and have shoulder range of motion deficits may be at greater risk of injury. So just some key findings. I think some more longitudinal research is needed, but ultimately understanding the native state by looking at the non-throwing arm material properties may be a significant indicator of a pitcher's risk factor down the road. So, thank you very much.
Awesome. Thanks, Chris. And now we'll go on to our second presentation. We had originally had Dr. Mike Reinold, who is the president and co-founder of Champion Physical Therapy and Performance, and is also the senior medical advisor for the Chicago White Sox. We had him slated here, but he had another conflict. And so he did pre-record his presentation, which we'll be showing. And his co-author, Dr. Glenn Fleisig, will be handling questions with Chris after this presentation.
Hi everyone, I am Mike Reinold and I am honored to be here today giving you a presentation of our poster abstract for the American Baseball Biomechanics Society first annual conference. It's obviously an honor to be involved with such a really neat and I think going to be very important society and group of people in the future. So it's an honor to be involved. I'm going to be presenting today on our recent publication. It was actually just published in the Journal of Sports Health on the acute effects of weighted baseball throwing programs on shoulder range of motion. I did this with my colleague Lenny Macrina up at Champion PT and Performance in Boston, as well as Dr. Fleisig, Dr. Andrews, and Monica at the American Sports Medicine Institute in Birmingham, Alabama. As we all know, if you work with baseball players, we're seeing a ton of injury rates continue to increase over time in baseball. And one of the things that we have attributed some of this to is potentially some of the aggressiveness of our training programs to increase velocity and performance. And some of those are obviously centered around weighted ball programs. So this is actually a follow-up study to our original article that we published in 2018 in the Journal of Sports Health that showed after a 6-week throwing program with weighted balls that we saw an increase in shoulder external rotation range of motion. But this was a big 6-week program, very comprehensive. We wanted to see if we could manipulate the dose a little bit, right, and change some of the weights to see if we can see if it's a certain weight of ball, maybe lighter balls or heavier balls may have more of an effect on the range of motion. So we had 16 male high school baseball players with a mean age of a little over 17 years participate. What we had them do is we had them come to our center at Champion PT and Performance for 3 different testing sessions. So essentially we measured their passive range of motion using a standard goniometer and essentially had them warm up and then do a weighted ball throwing program. So over the course of 3 sessions, we had 3 different testing days. One was an acute change in range of motion with underload balls of 2 ounce and 5 ounce. Then we had a light overload day with 6 ounce and 9 ounce, and then an extreme overload day with up to 1 and 2 pound balls. And after they warmed up, did a little bit of a throwing warm up and then did these balls, they essentially then remeasured their passive range of motion. So during the procedures, we did 3 different positions. We did kneeling, rocker, run and gun throws. These are very common in the baseball training world for a total of 27 throws. And obviously compared this statistically. What we found was there's no significant difference in external rotation using the underloaded balls, but as the weight of the ball increased, right, from overload to eventually even extreme overload, the amount of external rotation also increased. So it had a statistically significant increase of 3.3 degrees with light overload balls and an 8.4 degree change with the heavy overload balls. And I will say too, is that's just the mean. We had a large amount of people with well over 15 degrees increase in external rotation in just a short period of time. So we thought these findings were very significant. So we know that throwing these weighted balls increase the amount of external rotation in the shoulder. We see this acutely. We saw this chronically over a 6-week program. We know from past studies that this external rotation also increases velocity, but also stress and injury rates. So we're at a bit of a predicament with weighted balls now as we start to see some of the mechanisms behind why they may be enhancing performance. It's probably from this increase in layback. So in the paper, in the discussion, we hypothesized a little bit more that we think that this is from desensitizing some of the proprioceptors, like the GTOs of the shoulder that allow this increase in layback. So obviously we're pushing these physiological limits. So as we continue to learn more and more, we see that weighted balls may in fact be helpful for velocity, even though maybe not as much as we had once initially thought were, but we're still seeing a small increase in velocity from weighted balls. But the question is, at what cost? Because we're seeing this acute and then chronic change in external rotation over time, which could be destabilizing the shoulder and leading to injury rates. So thank you so much for your attention. If you have any further information, you can obviously reach out to me on social media. And on my website, MikeReinold.com, I actually just published a nice review of this that goes into even more detail. So you can go with that in the blog section of my website and read even more. Thank you so much. Sorry I could not attend live, and hopefully Dr. Fleisig can answer all of your questions. Thanks again for having me.
Awesome. So like I said, we have Chris joining us, and then Dr. Glenn Fleisig joining us as well. And so just to kick off this question and answer, Chris, some of these initial ones are directly for you. So great stuff, Chris. Do you have any information or insights on the participant's humeral torsion or retroversion bilaterally and potential effects on the range of motion and or stiffness data?
I don't, and that is a fantastic question. That definitely, I think, is another next step in this research. I think that's something that we need to make sure we're not overlooking in baseball pitchers, whether it's in measuring range of motion or also in 3D modeling when we think about using rigid segment modeling. Not everybody's humerus look the same in pitchers, but definitely I think it's a factor in bilateral range of motion deficits, and it should be looked at.
And kind of similarly on measurements here for your study, Chris, when you tested range of motion, did you record data for passive range of motion and active range of motion, first off?
I did not. So it was just a passive range of motion test.
So if that's the case, then how can we be sure that the mobility in high passive range of motion athletes, if in fact we measure their active range of motion, they are nowhere close in controlling or stabilizing the present passive range of motion?
So I don't know that we necessarily can draw that as a one-to-one link. The reason that I did just the passive range of motion test is that's what's been previously reported in the literature as the injury risk factors. And so that's what we were trying to look at, was the relationship between the injury risk factors and the tissue mechanics. Another thing that people have talked about doing a lot lately is also functional range of motion, which I think is important, such as, what is the external rotation a pitcher is actually reaching during the pitch, as opposed to just a passive one on the table.
For sure, for sure. Switching over to Glenn now, really interesting findings about the potential negative unintended consequences of weighted ball use. With that, with what we know, do you think the risks outweigh the rewards?
Yeah, that's a good question. I don't think that's for the scientists to decide. I think that's for the athlete and the team to decide. Our job is to show what the risk is and what the reward is. And then it's a judgment call. Just like when we did Little League Baseball and youth baseball, we found out you pitch this amount, you have this risk of injury. It's not our place to say, here's where you draw the line. But anyway, going back to this study that Mike just presented and our previous two show that when you train with weighted balls, you do seem to have an increase in velocity, the group as in general does, and an increase in shoulder external rotation passively, and also an increased risk of injury. So if we could, as biomechanists, quantify what those risks and reward are, it's not our place to decide whether it's worth it. It's our place to show what it is.
Sure. I'm going to take a little bit of moderator privilege here and ask a question. Do you think that, a lot of the studies that come out here as it pertains to weighted ball, and Chris, also feel free to jump in here, really look at 6 to 12 week time frames of really aggressively, like Mike said, really aggressively try and push this. What are your thoughts on extension of that training period and what we may be able to see if we ask the athlete to adapt over a longer period of time?
Yeah, actually, that's a great point you brought up, Bryson, because there is an infinite number of ways to do the training program. Of course, in this acute study that we just did in our previous 6-week training study and other people's 6 weeks training study, you have to have some kind of program, this many throws in this many days. But reality is there's many possible variations as you can imagine. The truth is, in my experience talking to the pro teams, and to drive blind and people like that. Some people do the weighted ball training as an off season, but some players do it during season. I think it's more common in the off season as a strength and velocity building program, but some actually do it in the season. And I think when a lot of things, moderation is a key. And so I think the dangerous thing is these all-out extreme programs. I view weighted ball training as part of the total training and conditioning package for the baseball players. It's not instead of long toss or bullpen work. You got to figure out how many total throws and add them all together, and it's a valuable part of that. But I don't think extreme is ever the best. I think the best is a well-designed program that includes different things.
Yeah, and I'll kind of flip that question over to you, Chris, on the sense of, through your work, you worked with a lot of the pitchers at ECU, maybe some of them have. Do you see anything from a stiffness standpoint of how they approach workload and throwing programs? Any comments there?
So we haven't done any formal research looking at different training programs and its effect on tissues. I do think certainly there will be some effects, and honestly, I think as Dr. Fleisig was saying, in moderation and also in continuation, when we think about strength conditioning, nobody thinks about just doing a 6-week bench press and then they're going to be strong for the next year, right? Like it's always a continuation thing. But I think also incorporating proper recovery time, and I think that's where the effect on the specific tissues would come in. Just like we would see with strength conditioning in season, right? Perhaps it's the right thing to do, and I think maybe this is a place for professional teams, because it's a little bit easier to do a longer study in that kind of setting, to do the research on kind of the longer effects and the more moderate effects, but then also the longer gains as well.
For sure. Going back to your study in particular, Chris, did you see any relationship between loss of internal rotation and supraspinatus stiffness?
Yeah, so with that significant interaction, I think one of the really interesting things there is in the pitchers that developed GERD, the pitchers that presented with GERD, they had the significantly lower stiffness in the non-throwing arm, which means if we assume that that's the native state of the throwing arm as well, they increased the stiffness of an external rotator and then presented with a loss of internal rotation. And so I think there's a large logical leap there. Certainly, I know we can't necessarily claim causation when we're looking just cross-sectionally, but I do think that there is a relationship going on between changes in specific tissues and then the functional deficits that an individual would present with.
And this is probably a question more geared towards Glenn, but open to both of you. Are there any studies that had the players use the weighted balls that elicit the least amount of stress on the arm? If the structure of the program and weights weren't the same, how are we kind of building the research and building upon studies?
Right. So again, I tip my hat to Mike Reinold. He's really been the brains driving our series of studies. But our first study looked at the biomechanics of throwing different weighted balls. Then our second one looked at the effect of a 6-week training program. And the thing we seemed to notice in the 6-week training program was that the heavier balls and the very heavy balls seemed to have a different effect. So what Mike was trying to show was we were trying to quantify it, and it seems like the extremely heavy balls, the 1 and 2 pound balls, have the biggest gain of external rotation in your arm on the passively on the table, and the slightly overloaded balls, the 6 and 9 ounce balls, have somewhat of a increase. So I guess to answer your question, we are studying this one piece at a time, and again, there's infinite combinations, but I think one piece at a time is interesting. And at this point, I would say the overload balls, we see the benefits of the heaviest ball in gaining external rotation. We see the benefits of the slightly overweight ball in increasing, in improving your mechanics. That works for the mechanics, we see that. And the underweight balls, we're not exactly sure the value of it, but basically we're studying bits and pieces in a series of studies.
And maybe we have to kind of wrap up the session with this, so I'll kind of open this to the both of you. Is there a sweet spot of weighted ball versus injury risk where you have a satisfactory increase in external rotation for lower injury risk, and maybe that just gets at to what do you think are our next steps towards maybe trying to find that sweet spot?
I'll take that first, Chris. Okay. Okay. I think what we're seeing is weighted balls help you improve velocity. I think what they're doing is they're not really building strength or speed. They're building external rotation. I think that's what most of the research is pointing towards. And our previous studies have shown more external rotation correlates to more ball velocity. So the question you're kind of saying is, how much can you do? How much external rotation is beneficial, and therefore how much ball velocity can you gain? And the answer is it's very individualized, and you have to listen to your body. And so one program doesn't fit all, but especially at the adolescent level. So the science here is the science, but the application is really an art, okay? And so whether you're at Driveline or the Baseball Ranch or the Milwaukee Brewers, wherever you're at, you have a program, and you have to customize it to each person, and you have to listen to each person's body. If they are sore, I mean, don't be dumb. That's a signal that something's wrong, and you want to shut it down when they're sore, not wait till it becomes an injury. So that's my answer, I think.
Sure. Chris, anything to add there?
Not a ton. I would just echo that and say that we're all searching for that sweet spot between performance improvements and injury prevention. And if we knew where it was, I don't think we would need the society. And a lot of us would be jobless. So there is a lot of science that will be done. But just to echo Dr. Fleisig's point, pitching is an individual motion, and this is where coaches are so incredibly important, and the trust between athletes and coaches and scientists, because it is going to be on an individual level.
Absolutely, no doubt. Well, thank you both for being here. Also, unfortunately, Dr. Mike Reinold couldn't be here, but thank you to him as well. But thank you, Glenn. Thank you, Chris.